Will you be voting for the first time this presidential election, or perhaps your political views have changed since you were a first-time voter? You can voice your opinion on our website, NewMexicoInFocus.org, or connect with us through social media. We're certainly on Facebook and Twitter. Now, welcome to The Line. New Mexico Attorney General Hector Balderas ended an almost 3-year investigation when his office announced this week that the last 2 of 15 behavioral health providers had been cleared of Medicaid fraud. Funds were suspended to 15 providers throughout the state in 2013 over such allegations, and during that time, many went out of business. The state's Human Services Department brought in 5 companies from Arizona to take over as replacements, but 3 of those companies have either left or plan to leave New Mexico. And the most recent one, Agave Health Inc., is planning to pull up stakes here in June, right around the corner. To talk about this and other news around the state, I'm joined at the table today by Tom Garrity from the Garrity Group PR. A new regular on our Line panel, former state representative Janice Arnold-Jones is here. Yay, Janice. Marcia Garcia with Strategies 360 is back. And Russell Contreras, our old friend, reporter with the Associated Press. Welcome all. Tom, the AG's office found some regulatory violations and about, chump change in misfiled things compared to the many millions we were led to believe happened here. We've got to close on this story of one sense, but we're opening up another phase of this, aren't we? It's very difficult to kind of pin it down at this point.
Yeah, and it's just a travesty. I mean, when you look at the number of New Mexico residents who were negatively impacted as a result of this, literally an administrative action, because clearly it wasn't a criminal action.
That's right.
As was stated by the Attorney General. Here's what's really fascinating to me about this whole thing is that it all started with an audit by Public Consulting Group.
Right.
And in that was, in their initial finding, was some wording that said there's no credible evidence of fraud. $36 million later, added on another 1.1 for the auditing. Everything backs up that original claim.
That's right.
And so, all of this is for naught. And we have 15 businesses, which are, most are already out of business. We have other businesses from out of state who have come in and said, you know what, we're washing our hands, have fun, New Mexico, we're going back to Arizona.
That's right.
And so I think the big challenge now, as far as, this whole story has been through a couple of different life cycles, is what happens next.
Right.
How do you reach out to the most vulnerable New Mexicans and help them to get the help? And it's not just like going to a gas station, right? I mean, you have to build relationships and you have to build trust. And right now, the trust with the general public, with the voters, but more importantly, the trust with those patients, those customers of behavioral health services is broken, and they need to fix it.
That's right. Janice, interestingly, I mentioned Agave Health Inc. is leaving a lot of northern New Mexico, Santa Fe folks, 3,000 people affected. How does one make up that kind of service, as Tom is mentioning? 3,000 is a tremendous amount of people.
Well, this is the backside of the travesty is we don't, as near as I can see, we do not have the people, we do not have the employees to actually close the gap right now. And I believe in this action, over 1,200 people lost their jobs. But when I say they lost their jobs, these were the people providing the services. Where are we going to replace them? And so it becomes even more complicated. I mean, what a complicated story, but it did begin with an audit. And let me remind you that it was a no-bid contract.
That's right.
And just a cursory look, I don't even believe that this company was an approved audit services company by our standards. So how did this one mistake snowball into this disaster?
Right.
And looking at it from just a business perspective, okay, so sometimes billing gets mixed up. There are 15 companies. If the AG is right, that's about $78,000 a piece. So why didn't Human Services say, we're withholding funds until we resolve this?
Right.
If it had been the $36 million, we're talking about $2 million a company.
Right.
Same strategy. Why would you put people out of business, even inadvertently?
Yeah, that's interesting. The report that Tom and Janice mentioned, the PCS report, the company out of Boston, interestingly, they were not allowed, or we're not quite sure how this happened, their own protocol. Meaning they come up with this audit, and their usual way of doing it is to show their findings to the groups that are affected. They get a chance to respond. They get a chance to explain themselves. That didn't happen this time. That seems very problematic for a lot of people here. What's your sense of that?
Yeah, when I remember the story was, when we got the story at the Associated Press, we came out and we contacted some of these facilities, and they didn't know that this had gone down. They wanted a chance to respond, and they were like, well, I don't think this is accurate because I would have been told. So this story came out and it started snowballing, and then we were unclear if people were upset about it, were upset because these were businesses in their constituency. So you were like, okay, well, what's going on here? You know, is this just a political football?
Yeah.
And then as it started to snowball and get worse, you started to see the people affected. Yeah. This is a state that just got a Kendra's Law passed. This is a state that doesn't have enough beds for the mentally ill or those fighting addiction. So to put us in this position, I think hurts us in the long run because of this, the way this was handled, the way, and just so much uncertainty. I don't think this is going to be addressed, especially in a city like us. We've had a number of police shootings with folks who are suspects who are suffering from mental illness. But this is going to transcend this year. It's going to continue. I think we're looking at maybe a 3 or 4 year process till we get back to where we were.
And in that process, Marcia, lawsuits. We had a little tidbit this week that came down. We've heard about this infamous plane from the administration that somebody around the state's been flying around in a plane on Medicaid dollars, and now we've got the early rumblings of a potential lawsuit from this company. I have to think this is going to end up costing the state and a lot of us who live here in this state quite a few dollars before it gets straightened out. What's your sense of it? Is that what's going to happen here?
Absolutely. I mean, the thing, what got to me the most was that there could have been other steps taken from the administration. They could have added monitors to these companies if there was even any type of inkling of alleged fraud. But they chose to freeze funds. That was not a mandate that they had to do. They chose to do that. And I don't think that I think we need to look past the dollars that it may cost taxpayers. What about the lives that are going to be affected?
That's right.
What dollar amount do we put on children that desperately need this care, that need behavioral health care, and that this is the only way their family can provide for them?
Right.
What happens to those kids? What happens to the elderly? What happens to the rest of the adults as well? So it may take us years to get back to where we're functioning at a place where we were before, but at the same time, some of these families are never going to recover.
That's right. That's right. Janice, real quick thought before we get out of here on this one. Marcia just reminded me, another wrinkle this week, the idea that there's been a call for PED to have a federal monitor come in and help get through this process. What's your initial reaction to that when you heard that?
I appreciate the sentiment, but let's look at federal monitors that have been in our state and how much we have paid for them. Yes. I think we are smart enough to find other solutions, but clearly things need to change. And the first place to start is in behavioral health because we have lost our services.
Russell, finish up on that one if you would. What do you think about a federal? Somebody just overlooking, not to take over, just say, look, let's get this straightened out. Let's figure this out.
You know, anytime you bring another agency, what you're trying to do is look for a teacher to come in and say, you know, can you put the substitute teacher right? And I don't think that it's going to take a longer than someone coming in outside force.
Yeah. Interesting, isn't it? Yeah. When we come back, the line will look at possible court order to stop New Mexico officials from withholding refunds of excess tax payments from immigrants.